Psoriasis affecting the scalp is scalp psoriasis. Scalp psoriasis presents with thick reddish or skin-colored plaques with silvery white scales which can extend beyond the hairline and sometimes may affect the nape of the neck. Psoriasis of the scalp may appear as an isolated condition affecting only the scalp or may appear as part of generalized psoriasis elsewhere in the body. Welcome to this video on scalp psoriasis requested by one of our subscriber, Dr. Nibi Nias. Dr. Nibi Nias has requested, could you please explain about scalp psoriasis and its treatment? Yes, Dr. Nibi Nias, this video is for you. This video is dedicated to Dr. Nibi Nias. We'll be talking about scalp psoriasis. Psoriasis, as you know, is both a physically and psychologically debilitating disease impacting on quality of life similar to diseases like cancer, diabetes and depression. These are not my words. This has been proven by studies after studies published in various prestigious medical journals. One often asked question is, does psoriasis spread from people to people? The answer is no. Psoriasis is not a contagious disease. It doesn't spread from people to people. Another question frequently asked is, does psoriasis run in families? Yes, it does. It is said that if one of your parents have psoriasis, you stand a 10% chance of getting psoriasis, and if both parents have psoriasis, you have a 50% chance of getting the disease. But even if none of your parents have psoriasis, you may still get psoriasis. Genetic research has named and blamed several genes in the onset of psoriasis. So if you have a susceptible gene for psoriasis, you could get psoriasis. But then everyone with a susceptible gene doesn't get psoriasis. So the factors which help the disease to manifest in a person who is having the susceptible gene are called as the triggering factors. And the most important triggering factor is stress, both mental and physical stress. Other triggering factors could be a poor lifestyle, habits like smoking, alcohol, and bad sleeping habits. Now coming to scalp psoriasis, 50 to 80% of patients having psoriasis can get scalp psoriasis, or as I told you, scalp psoriasis may present without psoriasis in other parts of the body as an isolated condition. I personally feel from my 18 years of experience treating psoriasis patients that almost 80% of patients who have generalized psoriasis do get scalp psoriasis. All the triggering factors that trigger psoriasis can trigger scalp psoriasis. Stress, as I told you earlier, is a very important triggering factor. It could be a stressful event in your life. Other triggers could be an infection somewhere in the body. It could be an injury to the skin or the injury to the body, a sunburn. Weather and climatic conditions can trigger psoriasis. Many drugs and medications which are used for several other diseases could trigger psoriasis. Food and food habits, lack of sleep, habits like smoking and alcohol all may trigger scalp psoriasis, just like it triggers generalized psoriasis. Now coming to the symptoms of scalp psoriasis. Usually psoriasis is a non-itchy condition, but sometimes patients can have moderate to severe itching on the scalp, which may be distressing and embarrassing. Scratching can sometimes lead to pinpoint bleeding on the skin on the scalp. Now coming to the treatment of scalp psoriasis, psoriasis doesn't have a cure. Just like we don't have a cure for diseases like diabetes, we can only keep psoriasis under control by using certain medications. Scalp psoriasis can be treated using different modalities of treatment. We have medicines which can be applied topically in the form of lotions, creams, foams, etc., which usually contain a corticosteroid and sometimes scale softeners like salicylic acid, and also medications like vitamin D analogs like calcipotriol, which are very useful in treating scalp psoriasis. Then we have light therapy in the form of UVB or narrowband UVB, which can be delivered using special devices like combs and caps which can be worn on the scalp. In patients not responding to these medicines, we may have to start them on oral medications or injections, which are a bit expensive and also have a lot of side effects. We sometimes prescribe shampoos containing coal tars which help to get rid of the scales and reduce the symptoms of scalp psoriasis. And the most important thing that I tell you always is try not to stress out. Stress is a very important factor for both triggering fresh psoriasis or flaring up psoriasis. Psoriasis by itself can cause a lot of stress, and this can worsen psoriasis. So this is like a cycle. The stress causing psoriasis, psoriasis causing stress, and that stress again causing psoriasis. So you have to break this cycle. So try to be stress-free. Eat healthy, sleep well, practice yoga or meditation and some breathing exercises. Finding ways to unwind can cause wonders which will help you conquer stress and psoriasis. Hope you like this video. Please don't forget to give a thumbs up. Your likes and comments mean a lot to me. Please subscribe to Skin Doctor so that you don't miss important updates on skin and skin diseases. I am Dr. Sujit Kumar, your dermatologist. Until I meet you next time, namaste, take care and bye.